Hi everyone, Emma here. Yeah, I wanted to come on tonight because I've just been chatting to one of the mums who came to pregnancy yoga and was asking for advice on a local mums group. And the reason I'm doing a video about it is because I just think this is so common, that she's wanting to breastfeed. But got to baby being 3 weeks old and everything that she thought she was getting into routine with, everything went upside down, and suddenly baby's waking up, doesn't seem to be satisfied, feeding. She also was feeling really scared about baby coming in bed with her, and the safety around that. So she's chosen to give baby formula overnight to help baby settle and sleep for long periods. I just think this is really common, but some of the research that we share in the baby feeding class around this, so the first thing there is about baby's behaviour going up the wall at like 3 weeks old. 2 to 3 weeks is a really common time for babies to be having what you call a growth spurt, and it's when babies are signalling to mum's body to make more milk. And the way they do that is because nipple stimulation is what creates milk. So baby feeding at the breast, it's sending messages to mum's brain to more prolactin, and especially overnight we're especially primed to produce prolactin, which is the milk making hormone, overnight. So if you're going to supplement with any bottles and skip feeding, the overnight ones do not skip. Although it's, there's other coping mechanisms for coping with a newborn baby. No one's saying it's easy and that you need to do it without support. You do need absolutely to get enough sleep, and you do need support as well. God, we all need support. It's just such an unnatural way to do this on our own. So the other thing is around the safety, and babies. So when we think about safety, we want to keep our babies alive. That's the most important thing, and we have been instilled with a lot of fear around bringing babies in bed. So the risk, if you are bed sharing and breastfeeding and doing it safely, so that means it's a nice firm mattress. You're not on any drugs or alcohol. Baby's not under any duvets or pillows. No smoking, and there was no smoking in pregnancy. I will link to the La Leche League Sweet Sleep guidelines. So those are the main ones that stick out in my head. But basically, if you're following the safe sleep guidelines, there is no increase in risk. Mothers' brains are rewired in pregnancy, so all of the wiring changes so that we are physically and mentally primed to respond to our baby's needs. The minute they stir and move their head around, instantly you're awake. You don't go into the very deepest state of sleep, which is the fourth state, deep sleep. You do respond to baby. Formula does have an increased risk of sudden infant death syndrome when compared to exclusive breastfeeding, which is interesting, and I think it's really important information to know when you're making decisions about safety for your baby. And sometimes that might be a decision you make for your mental health, and no one can tell you what decision to make, but that is the information. And these are the things that we really want to get across to people in pregnancy, so that you have time to make these decisions. If you do decide to supplement with some formula, it's really important not to skip the breastfeeds, to put baby to the breast first and to supplement afterwards, so that nipple stimulation, that your body is being primed to continue to make milk, especially overnight. Rosie, who was on the other night, is just a fantastic breastfeeding supporter. She can assess a feed, assess baby's latch, make sure baby's getting enough milk. It's really, really uncommon for mothers not to make enough milk, but sometimes that is the case. Rarely formula is the answer in solving a breastfeeding problem. So if you're wanting to breastfeed, the most important thing is to speak to somebody to look at the issues that you're having, rather than to go on to formula, because then your body's not getting that stimulation and your milk supply begins to drop and drop and drop. Your body is so clever at knowing how much babies need. So when you're feeding baby somewhere else, your body goes, okay, make less milk now. And then your milk supply does drop off. Plus milk from a bottle, it's a very different feeding technique for babies. So a breastfed baby, the tongue is at the bottom of the mouth and the nipple is far in, and they're using their whole jaw to massage the breast and to draw the milk out. With a bottle, the milk is more pouring down baby's throat, so they put their tongue to the top of the mouth to kind of stop the flow. So it's two very different techniques, and some babies can switch between the two very easily, but some babies don't, and that's when you hear about nipple confusion. So I don't want to overload. I know that I'm just talking now, because there's so much to this breastfeeding stuff that you just don't even think about, and that's why it's really important to come to our feeding class next Tuesday night. Bring your partner, bring your mum. There's lots of little tips and tricks. We'll talk about the growth spurts, the times when these can happen, things that you can do to support yourself, how to get enough sleep while you're meeting your baby's needs. Yeah, please share this video. We would love to reach more people. Get as many people as you can along to our baby feeding class. This is such important stuff to get out there. Yes, so the links are underneath. I'm also going to link the Sweet Sleep from La Leche League. They do a fantastic book. There's also a book called 3 in a Bed by Deborah Jackson. That was my life-saving, life-changing book when my baby was 6 weeks old and wouldn't sleep on his own, realising actually babies know that they need to be close. They need to feel that closeness for feeling secure, and knowing that all is right in the world. You are their link to the world. Yeah, having said that, there's lots of different ways, but some babies accept, some babies don't. It's knowing what feels right in your life at the time, and it can just be a short-term solution for the first 6 to 8 weeks, and then transitioning baby out into a cot. Yeah, but doing that with all the information, and not what society necessarily tells us. Okay, so stop waffling now. Thanks for listening. I'll see you soon. Bye bye.